Welcome everyone to today's session. So as you might all know, we are in the Open Education Week, which is from the 4th to the 8th. And to celebrate the Open Education Week, we have organized an event on advancing planetary health through open education. As we know, planetary health is a critical topic at the moment, and uh, connecting it with the Open Education Week will for sure try to help to bring more awareness to this topic and how having an open education or open access planetary health education could help to get advanced in this matter. So to begin with, I would like to first start to introduce our speakers today. So first, I would like to welcome Lydia from the Planetary Health Report Card. She'll be talking about the Planetary Health Report Card and their work. And I would also like to welcome Jeff, who is the Senior Director of Product from ScholarRx. And I'm Mustafa. I'm a marketing manager from MeSAGE. So, Jeff, do you want to talk about ScholarRx?
Sure. Thank you, Mustafa, and welcome everybody. It would be great. I see the numbers are growing. Be great if you hit the chat and just tell us, who you are and where you're from. Love to learn a little bit more about you and anything that you might be hoping to learn. So I'm Jeff Downing. I'm the Senior Director of Product here at ScholarRx. Our mission is to build a healthier world through accessible and sustainable medical education. So, we have a digital learning platform that is working to help transform health professions education on a global scale, and really working to design it in a way that helps empower, educators and learners. So we'll talk a little bit about how we do it through our BRICS program. But when we talk about BRICS, these are, digital learning experiences that are, designed to help prepare the next generation of healthcare professionals. Just as a side note, today, as part of Open Education Week, we were very committed to the principles of open education. We definitely see this as a cornerstone for democratizing access to medical knowledge and really help foster a more equitable learning environment. So our hope, our commitment here is grounded in that belief that high quality medical education should be accessible to everyone, regardless of geographical, financial, or social constraints, right? So just proud to be a part of OE Global and participate in Open Education Week and work to promote OER resources and practices within the medical education and health professions education community and beyond. So thank you. I'm glad to be here. Glad to see all of you. Back to you, Mustafa.
Thanks a lot, Jeff. So to also talk a bit about MeSAGE. So what MeSAGE is the Medical Student Alliance for Global Education, and it was founded and supported by ScholarRx. So its mission is to empower medical students to identify the gaps within the medical education curriculum, and then again to build open access medical education content that addresses these gaps. So we are working with around 11 medical student organizations, and they are all medical students who help us and support us in building the open access curriculums. And of course, like all of our open access, they are made from students to students or for students, but they're also reviewed or edited by experts in these fields. So we currently have 6 BRIC collections. We've published 6 BRIC collections, and BRICS are digital learning modules that are interactive. And the collections include multiple BRICS. So we have shared our collections on diversity, equity, and inclusion, sexual and reproductive health and rights, planetary health, digital health, new educator, which empowers students to become educators or even help educators to improve themselves, and also social accountability. And currently in development, we have 3 collections that we are currently working on: health policy, global health, and leadership management. So today we are going to be focusing more on our planetary health and what planetary health is. So the objective for today's session is we're going to be covering the fundamentals of planetary health. We will recognize the role of healthcare professions in that field, and how open educational resources impact or affect the planetary health education, and also to learn how the planetary health bricks can be adapted by educators. So to begin with, why planetary health? So planetary health is the broadest concept that pulls together everything that's related to health in the planet. So it's not only covers the public health, global health, One Health, but it's about the health of every being within the planet. And we as humans sometimes might only be focused on the human health, but we have to also focus on the other areas on the bio. And if you don't take care of the biodiversity of the planets, of the plants, and the animals that support us, then we are in trouble. And we so intensely depend on these other resources that help us. For example, clean food, clean air, clean water, households, and everything that we need is coming from the planet. So that's why planet as an umbrella of that covers the health of every being within the planet. And as a as healthcare professions, it's quite crucial for us to learn about this concept. Um, so, and to ask if why is it important to consider the broader concept of planetary health and just climate change, we can see that climate change is only one of the factors that's impacting the planet's environment or the planet's health. So the planet has been assessed by 9 boundaries, and we've so far exceeded 6 of them, including climate change. So climate change is not the only it's not the only factor that's impacting it, and it's a much broader image that many other factors play as well. So, for example, like if you look at it, you can see the inner green circle. That's our safe operating space, and we have so far exceeded 6 out of 9 assessed boundaries of our planet, including novel entities, which includes all the synthetic materials like microplastics and so on that we've polluted, and also the climate change, the land system change, and the freshwater, and so on. So this is to summarize why the planetary health does not equal to the climate change. And there's also some misconception between the planetary health and the health of the planet. So the health of the planet might be a more general, broader term, but the planetary health is specifically concerned with the health beings within the planet. And we can also take a look at the determinants of health that are impacted by the environment. And sometimes you might be very focused on only carbon emission, and we try to get into to the goal of reaching net zero carbon emission by 2030 or 2050. But even if we were to meet that tomorrow, it's not going to be enough, because there's a lot more more factors that have a role in impacting the health of our environment, including air pollution, the quality of water, climate change and health, as we talked about, and also severe weather events and extreme heat. And we can also see that a lot of new diseases are being spread due to the change in our environment, and also it has a big impact on the food and water security as well. So why is it important as health professions to learn about planetary health? Because it equips them to address the complex connections between these environmental factors and the human health, so that we can be ensured that we have a holistic approach to diagnosing and to taking care and managing these health-related cases. And we are going to see some numbers as well. So as healthcare professions, it's not enough to only observe and look at the impacts, but we also have to have an active role in trying to address these issues and to work towards making them better. And that's by being able to have planetary health as an educational integration in the curriculum. So unfortunately, a lot of medical schools have not yet integrated planetary health as a core curriculum. And that's why one of the strategies to do that is, first of all, to integrate planetary health as part of the curriculum, and then also to promote active learning by case studies or field experiments and field experience as well, and also to be able to promote interprofessional collaboration and to have collaboration between different professions with the aim of to understanding the planetary health better. So if you look at some of the numbers, there are 7 million premature deaths per year, and 25% of global death is linked to environmental risks that are actually modifiable. And as we talked about earlier, 6 out of 9 planetary boundaries have exceeded.
I'm in a meeting.
So the planetary health, so now that we have a little bit of understanding what planetary health is, I'm going to talk about the planetary health bricks and why they are important. What are they actually covering? So the planetary health collection is developed by medical students as part of MeSAGE and have also been reviewed by experts in the field. So it's a collection of bricks that tries to cover the relationship between human health and the environment, and it empowers health professionals with tools and with knowledge to face these challenges of in the future and also at the current moment that are related to the environment. So we will try to also have a look at it, but first to just walk you through the bricks a bit. So in the first, we've broken it down into like 14 bricks or 14 different sections. So in the introduction to planetary health, it tries to introduce why is planetary health important and why is it a determinant of health, and also talks about the boundaries of the planet in health-wise, and it also focuses on specific health challenges, not only from a global perspective, but also shows some case samples from different parts of the world, and tries to talk about these specific health challenges like air quality, air pollution, water quality, and also tries to equip healthcare professions or physicians with knowledge on how to let's say point towards extreme heat and severe or tackle these severe weather events and tackle these challenges in their practice. And it also covers some different parts, some specific parts that are impacts of the environment, like mental health and the environment, climate migration, displacement, and also not only covers these topics, but also tries to provide tools like climate mitigation and adaptation, and also tries to help students and institutes on how they can get strategies that could help them to face these health challenges. So if you look at it, this is
His TT went to work.
Yeah, his break is over.
Okay.
So this is the planetary health collection. So the planetary health collection, as we talked about, it includes 14 bricks, and they're all open access and free to access by anyone who would like to get knowledge about the topic. So in each brick, we are going to have like different topics. So in each brick, first of all, there's a very new feature where you could also listen to all of the bricks. So each of the bricks covers different topics. So for example, in the introduction of health, as we talked about, it covers the planetary health and global environmental change, the environment as a determinant of health, and so many more topics. And it's an interactive model where it helps you to learn more by flashcards or different bullet points, graphs, and so many more. So this is just a quick overview of how you can interact with these bricks and how you can use them, utilize them as a medical student or even as an educator in your schools. and there are like multiple choice questions or questions where you could answer and learn more about the topic. So overall, it's an interactive module, and each of the module tries to get you to learn more about specific health challenges. For example, like if you go to extreme heat, so it defines the extreme heat and also gives you case connections on how you can tackle these challenges as a physician, and what are the clinical presentations associated with extreme heat. So it discusses also the strategies to minimize the health effects. So as we talked about, they are not only uh, educational topics, but also it gives you the right tools and strategies to face or tackle these challenges through different graphs and so on. So I will try not to get too much into topics. I would also like to leave the link in the chat, so you're also able to explore more on your own and see how you could use these tools to empower yourselves or to empower your other colleagues who are who are in the health profession field, and how you can all try to work on first of all empowering yourselves with knowledge and then having an impact on the environmental health. So that's it from my side. Jeff, I will pass it to you.
Okay. Excellent. Thank you, Mustafa. So what I'm going to do is, here, I'll just take over for a second. So what Mustafa was showing, the work that the MeSAGE team has done, and MeSAGE, as he said, it represents 11 student organizations around the world that account for over 1.4 million med students, and part of their mission is to identify critical gaps within the traditional curriculum that today's physicians need to know, especially for tomorrow, and that's really what helped drive this. As we think about it, we see from a platform standpoint ways in which we can make open education resources like these bricks, high quality and accessible to as many people as possible. So the part of our our pledge is trying to democratize access, and then really kind of foster collaboration. And I'll show just a little bit about what that means, because there's a couple of things that we've built within our platform, which is called Bricks Create, which will actually help clone and modify OER resources so that it's easy to replicate and tailor these bricks to meet the learning objectives or the curricular objectives of your school, and also provide ways for translation and localization. So with that, I'm going to go back into the Exchange, and we did share a link so that you can, at your leisure, whenever you want to, you can come in and take a look at all of these bricks. But what I'm going to do is I'm going to show you how you can actually share and modify your the work here. So within each of these bricks, you can see the little ellipsis here. So if you're signed in, you will need to you can set up a free account, and so you can sign in for bookmarks and to actually create bricks. But again, that's all it's all free. So you can see I've got a couple of different options here. I can share a link to this brick on air pollution, or I can clone it. So I'm going to clone this brick. One of the things that we recognize is that about 85% of the the published resources in medical education are published and delivered in English. And there are 7,000 languages, spoken around the world. So, we always think about it in terms of, students that are, perhaps in different parts of the world where even though your patients may not be speaking English, you may be learning about these things in English. So one of the things that we've worked on is, hey, can we to help you customize these bricks so that they meet your needs. So right now we've actually at the point at which you clone a brick, and this basically just means you're making a copy of the brick for you to work on. So I'm gonna show you two things. First thing is on the translation side. So right now you can actually clone a brick into Spanish, French, Portuguese, or Vietnamese. We're going to be adding more languages here later this year, but essentially what the system will do is say, okay, I want to translate this into Portuguese. It's going to clone this brick, and this is a brick on air pollution. And what it's doing is, it's doing a machine translation, and then it gives you shows you, hey, what this brick will look like. Especially if you're teaching in Brazil or teaching in Portugal or other countries where Portuguese is the main language. All of that is here, and then you could then publish this brick, and it will for those that want to be able to benefit from having this Portuguese translation, it's there for them. Okay, so this is again, for us, we want to make sure that this material is available and accessible. And then, and we think about planetary health, it's not just for med ed. There's a lot of these topics are things that can be used in different in different contexts, especially around the issues of planetary health and climate change. So that is one option. The other thing is now I'm just going to clone this brick into English. And what this will do is just kind of show you how this works. It really doesn't require any significant technical skills here. You're not going to have to learn how to code anything. But essentially what you can see is that this brick on air pollution is now in draft, and you can see that it's being adapted by me. And for all the things that are in here, I could come in and say, hey, I'd like to add a new learning objective, or perhaps I want to, remove an objective. I could take that out. I could, make changes to the case connection, and I could say, John, you can go in here. And all of the things that are in here, you can see it has a, it works just like WordPress or any other platform where you can come in and add and edit any of the material that's in here. And especially if you're an educator that is working on perhaps a planetary health elective, or you want to embed this integrate this kind of material within your courses, you can do that. Let me pause here. So I've got one on, this is a brick on air pollution. Let me I'm gonna launch a poll here. And what I'd like you to do is let me know which city currently has the most hazardous air quality index, the most hazardous AQI. Is it Tehran, Wuhan, Lahore, Hanoi, Los Angeles, or Delhi? Go ahead and take a shot. Wait till 2/3 of you have voted. Okay. Excellent. Okay, almost everybody's voted. So I'm going to end the poll. And let me share the results. So you can see that it was a tie between Delhi and Wuhan, with 1 vote for Lahore and 2 for Los Angeles. The correct answer, Hanoi. Hanoi, Vietnam is currently has the most hazardous AQI in the world. So, this is something where, perhaps if you're teaching in Vietnam or teaching about this, you can come in. I'm going to go into the brick here. So we have this section on measuring air pollution, and it says, this talks about how Delhi was the most polluted city in the world in 2022. But I could change this and say, currently the most polluted city is Hanoi, Vietnam. According to that. So again, I could come in here and just make, I can make changes. I could also add, you can see all of the different things I can add. I can add text, I can add headers, I can add tables, images. So I'll add an image here. And I can see the top 5 most polluted major cities. So again, the idea here is that you can build or tailor any of these bricks, and then I could publish them, and then I would be publishing it under the license it was created under. So it may be under a Creative Commons, or if it's published under like a ScholarRx license, it would be under that. But all of these things you could have a link that you could share with anybody in the world. Okay. And the other piece about the exchange is that you can search for particular topics, and you could see all of the we've got a lot of all of those free bricks here on from the Planetary Health, but you also would see from bricks that were created by others around the world. So, like this brick on rural remote and planetary health. This is, created by a student, and then, you could actually take this and also customize it and share it. So, so a lot of different things that you can do with the Bricks Create platform. And again, the idea here is, making this content accessible, and then giving you the tools to tailor it and improve it and share it more widely. Okay, so with that, what I want to do is I want to turn it over to Lydia, because it's one thing, helping to underscore the importance of planetary health, but it's another thing in helping institutions hold themselves accountable. So I'm going to pass it over to Lydia, and and she'll tell us a little bit more about what the work they're doing is at the Planetary Health Report Card.
Great. Thank you so much, Jeff. And thank you for having me today. Jeff already introduced it. I'm one of the partnership leads together with Madeline, who unfortunately can't be here today, at the Planetary Health Report Card. We're an entirely student-led project. So all of us are still in school. Most are in med school. Others are at other types of health professional schools. And a few years ago, I think now it's been roughly 10 years, we started the Planetary Health Report Card, which is a metric-based, a student-led initiative that's supposed to hold institutions accountable and infuse the medical curriculum with more planetary health-related teaching content. That's what we're trying to do. So what we do we have 5 metrics that are evaluated every single school once a year to kind of trace progress over time, have a longitudinal kind of like chart. And we have 5 different metrics currently. So we look at the curriculum. For example, especially at the core curriculum, is there anything as taught about planetary health? And if so, how much? Then we also look at research. For example, are students given any types of opportunities to conduct research? Is there any staff at the schools? Are there also qualified staff? We look at community outreach and advocacy. Sometimes, especially public health schools, for example, sometimes have community outreach programs set up to look at, for example, stuff like energy democracy, making energy more sustainable in collaboration with the local community. Another thing we look at is the support for student-led initiatives. Is there any type of institutional support available? And then also we look at the sustainability of the institution overall. And so these are all 5 metrics, and they're evolving, and they're collected, as I said, annually. And then we publish our Planetary Health Report Card report every year on Earth Day. So that will be in April. And yeah, so we're currently about to finalize data collection for this year, and just this hopefully publishing it soon. Could you go to the next slide? Thank you. Yeah, so as I said, we started rather small with a few schools in a few countries, and now we're growing every year. And we have an outreach manager, someone to support evolving regions. We're represented all over the world currently. Here you can see on a map, we're quite heavily represented in the UK and in the United States, but also we have a lot of other countries and schools joining as we grow. And something else we do is initially we started with medical schools, and now we moved on to also include other health professions. I think it's on the next slide, sorry. Thank you so much. So we have nursing programs now, as well as also pharmacy schools, physiotherapy, dentistry, occupational therapy. So the whole range of health professions. And we're trying to expand and trying to look at this from a more holistic perspective. And yeah, we're currently, as you can see on the next slide, there's a lot of research. It's a very emerging field on this. People publish the work they do with the Planetary Health Report Cards, a lot of opinion pieces. It's a lot of, we're trying to encourage students to be more in charge of what's happening in their institutions, to kind of like drive institutional change. And there is a lot of momentum currently for that, and a lot of interest. And so, yeah, I think it's a great time right now to be engaged here. I think the next 2 slides are just, we have a leadership team that we're all part of, but everything else really is, we're a big team. We have regional managers, we have school managers, we have people supporting schools that want to join the project. We have partnership leads like Madeline and myself. We try and reach out to other organizations that do similar work. That's also how we met Jeff at ScholarRx. We work with a Columbia research group on another collection of materials that schools can implement. And I think what's really important is we provide schools with those materials, including the new ones that Jeff just mentioned, the BRICS collection, Planetary Health, and then giving them the opportunity to integrate that, both for students as well as for the faculty. And then we kind of re-audit them a few years down the line. Hopefully we'll see some improvements and an improvement in scores for the individual metrics at schools. And yeah, that's a very brief summary of what we do. On the next slide, I have a link. I'm not sure if the slides are going to be shared. I can also put in the chat box where you can have a closer look at our metrics. Our metrics are constantly evolving and changing. We're currently considering to include another more political metric on engagement on a political level of different schools. And so really like reacting to changes that are happening. And yes, that's it. Thank you for listening.
Thank you, Lydia. And again, for those of you who have questions, please let us know in the chat. We'll put the link there to put a full link to the report card, and lots of good stuff there. One thing I want to note, since this is a wee week, they have a list of all of the student organizations, research data, sustainability advocacy, but also things on curriculum. So you can again, there's a lot of work that's that's been going on, and a lot of things that are being developed to try to, to close the gap. So part of what we want to do with the bricks is, provide those types of curricular resources. But we want to, we're so happy to see, the things that others are doing, advocating on behalf of planetary health. So lots of just a lot of really great things to dig into, especially if this is an area that you're getting interested in and want to learn more. Okay. One thing I want to just touch on here is, kind of closing the loop a little bit, is that, part of what we want to be able to do as well is, help students or help schools and organizations improve their grades on the report card. So we do have within our brick collection, we've actually gone through and mapped it to the report card. So I'll put this back in the chat here, but for schools, as they fill out the report card, these are some of the questions that they're asked, specifically regarding curriculum. So for instance, does your medical school curriculum address the relationship between extreme heat, health risks, and climate change? And so what we do is we share any related bricks that tackle those particular questions, as well as the related learning objectives that we cover there. So, we're really inspired by the work that the PHRC is doing, and all of the groups that are kind of connected to this clearly want to be able to help schools and educators, and of course students, get this into the curriculum. Okay. So with that, I want to pause. I want to give folks a chance. You can go into the chat or bring yourself off mute and let us know what questions you have, or things you're thinking about, or what you're doing at your institution right now to address climate change. Valerie offers a question here. When it comes to editing the bricks and being published, are there any measures put in place so you don't have a situation like Wikipedia where it is not a reliable source? That's a great question. And for us, all of the bricks that are published and made available through the community, they do go through a there needs to be a review process for those to show up within the exchange. So I'll bring one up that is not climate related, but the American Medical Student Association has been creating bricks on reproductive rights and sexual health and integrative medicine. And so for these to appear on the exchange, they have a reviewing process that helps vet those bricks. That's, so for us, that's critical. And for anything to show up in search, it has to go through that process. Again, these the bricks are owned by the brick builder, right? The educator or even students, but it does have to go through that process for it to show up on the exchange. Up to this point, we've had about a little over 2,000 bricks that have been created by educators and organizations and students, and those are and some of those are publicly listed and shared on the exchange. Let me know if that helps. Does that answer your question, Valerie? Okay, we got a quiet group. That's okay. That's and don't be bashful. Everyone here is interested in the topic and trying to improve it. We're not all experts in the field by any means, but we do want to help build more platforms so that this type of information can find its way into the hands of the next generation of doctors, nurses, and health professionals. Noe Woods asked, how were the planetary health bricks created? What was the review process? So it started with a global needs assessment. So the the representatives that are part of each of the MeSAGE Alliance partners, which again kind of represent 1.4 million med students around the world. They were looking at the key topics that were not being addressed or under addressed within the traditional curriculum, and planetary health was one of the big ones. So we worked with an expert in this arena who is Michelle McLean. And Mustafa can keep me honest, but Dr. McLean is based down at Bond University in Queensland, and is and really helped work with the team of students as they went through the drafting and reviewing process. So it was a combination of kind of the subject matter expertise, helping with the medical student authors and reviewers, as well as the editorial team at ScholarRx, who helped oversee the everything from art production to copy editing. So hope that helps. It's our collections typically take about 6 to 9 months to build. And then we also, through our system, can continue to make updates to them. Robert talked about hosting a carbon neutral event at Northwest College, offsetting 679 tons of CO2, which is equivalent to the emissions from the event's operations. That's great. So they've got students authoring an openly licensed sustainable events how-to guide that will be available in Pressbooks. Very cool. That's that is a great way to share that kind of experience so that others can replicate it. So thanks for sharing that.
And just to also add, I think that's a very cool idea, because there's many events that are happening, and I think a lot of different organizations might be looking forward to be more carbon neutral, and maybe even trying to create a brick, an open access brick, turning the Pressbook into a brick might also be a good idea if they are interested to make it available to people and to easily access it through a more interactive way.
This was a recording with with Dr. McLean, talking more about the going a little bit deeper on the planetary health bricks and the development, as well as some of the key questions. And I think one of the things that Dr. McLean was very interested in, one of the things that was really kind of driving her involvement there it's really about environmental justice. She felt like this particular brick is an important one, and is one that we need to be thinking very seriously about, especially when you think about the differences in terms of the traditional output of the global north and how that is affecting different systems across the globe, and how the global traditional global south is often having to shoulder the burden of impact. So again, this to me is it's just one of those bricks which just invites great discussion amongst students, and helps students really think about this from a global perspective, and understand things, how critical justice is around that.
Yeah, I was going to add on to that. As it happens, Madeline and myself, we're currently organizing a symposium on environmental justice. And we're still waiting for some of the speakers to confirm, but I'm not sure, Jeff. I can share the invite with you, and maybe if you have a newsletter or something, you can share it with your folks. If that's something of interest.
Yes, we would love that, Lydia. And Mustafa, we also have there is a message newsletter. We could put the link to that for those that might want to to follow along.
Yeah. I've just shared, you can go on our webpage for message, and there's like a box where you could fill your name and email to be subscribed to our newsletter, but also make sure to follow us on Instagram so that you don't miss any of our updates and any of our upcoming activities and sessions.
So we're coming close to the top of the hour. Really, want to thank Lydia for joining and collaborating with us on this, and thanks to Mustafa for helping organize it. Thank you, everyone, for being here. We do have a separate session on the Brick Exchange and the Bricks Create platform for those who might be interested in that, and that's going to take place on Thursday. And for those of you more medically inclined, we have a session tomorrow on neurology. So we're actually going to be talking about using collaborative approaches to advance open education, and basically it's a collaboration between the neurology clerkship directors at Harvard and Johns Hopkins. So they have a session tomorrow, a little bit later in the day, but would love to see all of you there. Thank you again for your time. Thank you for joining. Thank you for your interest in this critical topic. It's it's going to be one of the great challenges of mankind here for the next however long. So your involvement, your dedication, your energy, your spirit, it's going to be needed. And we want to help you in any way we can. Okay.